Hi guys, my greetings and warm welcome to everyone watching this video, in which I'm going to talk about the new supplement which I have recently formulated for two famous brands, MF3 and LaborMS. As in the case of the performance enhancement supplements, the review of which I presented in my other video, these supplements share some similarities in active ingredients, so I will go through each and every ingredient one by one and explain their benefits for health and longevity. The MF3 supplement is called Longevity Essentials Pro. This supplement supports longevity by providing optimal protection against various types of external and internal factors that may accelerate the aging process and increase the risk of age-related diseases. The ingredients comprise of potent antioxidants and polyphenols that play a key role in cellular protection against oxidative stress that could contribute to various chronic age-related inflammatory diseases, including cardiovascular disease and neurodegenerative diseases. The LaborMS supplement is known under the name Longevity and Vitality Formula. The LaborMS Longevity and Vitality Formula is formulated with flavonoids, polyphenols and catechins that possess protective effects against the development of several chronic diseases such as cardiovascular diseases, neurodegenerative, cancer, metabolic syndrome and premature aging, via multiple pathways, including the reduction of generation of ROS, the reactive oxygen species, and enhancing body's own protective and antioxidant mechanisms. Similar to the other supplement that I have researched, formulated and created, namely the Active Essentials Pro and Performance and Fitness Formula, the Longevity Essentials Pro and Longevity and Vitality Formula have been tested by me for several years with incredible results. As some of you may know, my main motto is practice what you preach. And by doing so, by following my own protocols and implementing to myself the very same therapeutic and wellness strategies that I'm promoting in my lectures and presentations, I have completely reversed metabolic syndrome, diabetes and obesity. From 130 kilogram, almost 290 pounds, a fat guy, to a men's physique bodybuilding contest with less than 10% of body fat, practically ideal blood work and actual reduction of my biological age, which in fact is confirmed by the epigenetic test, biomediscan, heart variability test, body composition test and various biological markers of aging. I made it a goal of my life to be a living proof and walking evidence to my biohacking and wellness protocols that our team is successfully implementing in a day-to-day practice of European wellness retreat centers. The improvements that I have observed in myself and those under my care are truly dramatic and intense. So I felt that it is absolutely important that I share this information with other people, especially those who may need it and potentially benefit from this data. Based on the scientific research that I have done and my personal experience over the years, our team of pharmacologists, nutritionists and nutraceutical product specialists have put all the active ingredients into a final product in a single tablet form. The supplements are produced in Switzerland according to the top international standards of manufacturing of pharmaceuticals and nutraceutical products and supplements. Each tablet is covered in a special enteric coating that increases the formulation stability, reduces undesirable gastric irritation, and prevents the premature release of nutrients in the stomach to ensure nutrients release and absorption predominantly in the small intestine. So let's look into scientific facts and clinical evidence behind ingredients of this amazing new supplement. Myricetin is a naturally occurring compound commonly found in plants that have antimicrobial and antioxidant activities. One of the beneficial biological effects of myricetin is the neuroprotective activity, which is demonstrated in preclinical studies on Alzheimer's, Parkinson, Huntington disease, and amyotrophic lateral sclerosis. Also, myricetin has revealed other biological activities, among them such as anti-diabetic, anti-cancer, immunomodulatory, cardiovascular, analgesic, and anti-hypertensive. Myricetin exhibited antioxidant properties and free radical scavenging effects as well. According to the data published in journals of Applied Biological Chemistry and Frontiers of Pharmacology, many of the therapeutic benefits of myricetin are realized through its antiplatelet aggregation, anti-hypertensive, immunomodulatory, anti-inflammatory, anti-allergic, analgesic, anti-cancer biological mechanisms of action. Myricetin has also anti-diabetic effects, which are well described in one of the publications in the Journal of Diabetes and Metabolic Disease in April 2019. In the same year, another experimental study published in the Journal of Frontiers of Pharmacology has evaluated effects of myricetin in diabetes-associated kidney injuries and renal dysfunction. The early data shows about 50% reduction of glycemia and nephroprotective effects against diabetes-induced kidney damage. The number one cause of mortality in adults and senior individuals is cardiovascular disease. Multiple studies have demonstrated beneficial effects of myricetin on blood vessels and prevention of atherosclerosis. The available genomic and genetics data from preclinical experiments have shown that myricetin is likely to confer the first line of defense against cardiovascular and other associated diseases. In summary, preclinical studies on myricetin have revealed anti-diabetic, anti-cancer, immunomodulatory, anti-cardiovascular, and anti-hypertensive activities. The second active ingredient on the list in the Longevity Essentials Pro and the Longevity and Vitality formula is soforetin, also known as quercetin. Quercetin is a flavonoid found in many foods and herbs. Extracts of quercetin have been used to treat or prevent diverse conditions including cardiovascular disease, hypercholesterolemia, rheumatic disease, infections, and even cancer. At present, the medical usage of quercetin is justified by its antioxidant, anti-inflammatory, antiplatelet, anti-apoptotic, nephro, gastro, angio, cardio, and chondroprotective properties. Chronic systemic low-grade inflammation is one of the cardinal hallmarks of aging. The effects of quercetin against inflammation suggest that it is a potent anti-inflammatory agent. In an in vivo study, it has been reported to show a reduction in the expression of inflammatory genes using a quercetin-enriched diet. The study shows that there has been a reduction in the risk of cardiovascular disease as well. In the earlier preclinical study, it has been demonstrated that a fourfold increase in plasma quercetin levels significantly decreased lung inflammation and prevented disease progression. And we're talking about COPD, the chronic obstructive pulmonary disease. Quercetin has been reported to have features of neuroprotection when used in combination with fish oil, which is available in abundance in another MF3 supplement called MCE Evolution. Subsequently, it has also been reported to show beneficial effects against neurodegenerative diseases. Quercetin supplementation in at least 150 50 mg per day reduced systolic blood pressure and plasma oxidized LDL concentrations in overweight subjects in 5 weeks double-blind trial published in the British Journal of Nutrition. The study done by Brule and colleagues studied the effect of quercetin on overweight to obese patients with pre-hypertension and stage 1 hypertension, and the study concluded that quercetin supplementation lowers blood pressure in patients with hypertension. Quercetin supplementation in a dose of 500 mg per day also reduced systolic blood pressure in women with type 2 diabetes. The next biologically active ingredient in these wonderful supplements is Apigenin in LaboreMS Longevity and Vitality formula and Versulin in Longevity Essentials Pro from MF3. A high number of studies carried over the years have indicated that Apigenin has many interesting pharmacological activities and nutraceutical potential. As an example, its properties as an antioxidant are very well known, and it can be also a therapeutic agent to overcome conditions like inflammation, autoimmune, neurodegenerative disease, and even several types of cancers. It has a low intrinsic toxicity on normal versus cancerous cells. The recent review of Nabawi and colleagues published in Journal of Pharmacological Research in February 2018, titled Apigenin as Neuroprotective Agent, discussed the evidence on the therapeutic potential of Apigenin as a neuroprotective agent against the depression, Alzheimer's disease, and Parkinson's disease. Apigenin may induce muscle relaxation and sedation in a dose-dependent manner, and it is also effective and active as an antioxidant, anti-inflammatory, anti-amyloidogenic, neuroprotection, and cognition-enhancing substance with interesting potential in the treatment and prevention of Alzheimer's disease. This disease is a progressive neurodegenerative disorder characterized by deposition of amyloid beta and neurofibrillary tangles leading to neuronal dysfunction and loss of neurons in the brain. Currently, the pharmacological treatment modalities for Alzheimer's disease basically is only symptomatic and focuses on the cholinergic transmission. Apigenin could represent a novel tool in delay of the onset of Alzheimer's disease or to slow down its progression once it is diagnosed. Along with that, Apigenin reduces the incidence of cancer. Knecht and colleagues investigated the association between quercetin, camphorol, myricetin, and Apigenin in the lung cancer. They found an inverse association between the intake of these supplements and incidence of all sides of cancer, which also provides strong evidence of a protective role of flavonoids against lung cancer. A study conducted by Madunic and colleagues reported the possible chemotherapeutic modality of Apigenin due to its low toxicity and remarkable effects on normal versus cancerous cells. Quercetin, Apigenin, and epigallocatechin gallate, EGCG, which is also included as an active ingredient in these incredible supplements from LaboreMS and MF3, were investigated as inhibitory agents of the growth and metastatic potential of melanoma cells. They found out that quercetin, as well as Apigenin and epigallocatechin gallate, significantly delayed tumor growth. By the way, speaking of epigallocatechin gallate, the EGCG, it's a unique compound of plant origin and has a massive positive impact on health. It is known to reduce inflammation, helps with weight loss, and prevents heart and brain disease. Research published in the Journal of Ethnopharmacology suggests that EGCG supports heart health by reducing blood pressure, reducing cholesterol levels, and the accumulation of plaques in the blood vessels, all major risk factors for heart disease. In an 8-week study, which included 33 subjects taking 250 milligrams of EGCG, resulted in a significant 4.5% reduction of LDL, the bad cholesterol. A separate study in 56 people found significant reductions in blood pressure, cholesterol levels, and inflammatory biomarkers in those taking a daily dose of 375 of EGCG over 3 months only. Additional human studies have collectively found that taking somewhere from 100 to 450 milligram of EGCG together with 80 to 300 milligram of caffeine for at least of 12 weeks is linked to a significant weight loss and reduction of body fat. In some studies, EGCG injections significantly improved inflammation, as well as recovery and regeneration of neural cells after the spinal cord injuries. Additionally, by the way, multiple observational studies in humans found a link between a high intake of EGCG and the reduced risk of age-related brain decline, as well as Alzheimer's and Parkinson's diseases. And last but not the least, Fisetin, a member of the flavonoid family, a naturally occurring polyphenolic compound, has anti-cancer activity and appears to block the PI3K/AKT/mTOR pathway, which is involved in cancer cells and promotion of cancer. Fisetin inhibits the activity of several pro-inflammatory cytokines, including the TNF-alpha, interleukin-6, and the transcription factor NF-κB. Fisetin has direct activity as a reducing agent, chemically reacting with and neutralizing reactive oxygen species and cancer-promoting genes. Fisetin also upregulates synthesis of glutathione, an endogenous antioxidant. Other biological activities include anti-hyperlipidemic, anti-inflammatory, and neurotrophic effects, some of which could be mediated through a reduction in the senescent cell burden. It is also known to reduce age-associated changes in the brain, including the progressive neuronal loss that happens in Alzheimer's. In addition, Fisetin also promotes synaptic functions in the hippocampus, which is paramount for healthy learning, memory, and adjusting mood. To summarize the biological effects and mechanisms of action of the Longevity Essentials Pro from MF3 and Longevity and Vitality Formula from LabRMS, the number one is regulation of oxidative stress, reduction of chronic inflammation, and anti-cancer properties. Number two, protective effects against cardiovascular diseases and metabolic syndrome. Number three, neuroprotective effect. Number four, immunomodulatory effect. The formulation is safe for consumption and generally has no contraindications. Suitable for individuals above the age of 18. The recommended dosage is 1 or 2 tablets, preferably before meal or a couple of hours after meal, preferably not to mix with other supplements or medications. So don't miss the wonderful opportunity to rejuvenate and strengthen your body and reverse aging with Longevity Essentials Pro from MF3 and Longevity and Vitality Formula from LabRMS. Thank you for watching this video. It was Dr. Dmitro Klokal, always here with you and for you. Stay healthy, be alive, have fun. Bye-bye.